healing, something much more than mere treatment. Many systems of medicine, both modern and ancient, have emphasized on the need for including the mind and the soul along with the body in the processes of healing, because that is true healing of the whole human being. It might seem difficult to find this kind of holistic health care in today's world, but a brilliantly innovative approach is at work in Mount Abu. Come, let's take a look at the marvel of the J. Watumal Memorial Global Hospital and Research Center.
High atop Mount Abu, in the Aravalli ranges of northern Rajasthan, India, nestled like a jewel among the trees, sits the pristine whiteness of GHRC, the J. Watumal Memorial Global Hospital and Research Center. This unique hospital offers compassionate healing and finest of care to all who come to its door. There is never a question of whether or not someone can pay, nor does their religion, caste or creed matter. Everyone receiving the finest possible treatment to be had anywhere in the world. True to its name, the Global Hospital serves the needs of about 20,000 local people, about the same number of tribals and village people, as well as some 1 million Indian and foreign tourists who visit Mount Abu annually. The moving force behind the hospital is the Brahma Kumari's World Spiritual University, a non-governmental organization affiliated with the Department of Public Information of the United Nations. The university, working for the betterment of mankind, has been the creator of many international projects and has received, among others, 7 UN Peace Messenger Awards.
मेडिटेशन एंड मेडिसिन, इन दोनों का आपस में संबंध है, सहयोग है। उसी सहयोग के साथ देखा जाता कि बीमारी में अगर उन्हों को संतोष, शक्ति और डॉक्टर्स लोगों की शुभ भावनाएं और सेवाएं दिल से प्यार से मिलती है, और साथ साथ उन्हों को ये योग की साधना का भी, रूहानियत की शक्ति का लाइट और माइट मिलती है, तो जो बीमारी अनुभव करता कैसी भी हो वो सहज पार हो जाती है। हर हॉस्पिटल में अगर ऐसी बीमारी के लिए मेडिसिन भी हो, परंतु मेडिटेशन भी अगर हर हॉस्पिटल में रखे तो हमारे डॉक्टर्स की सेवाओं की, पेशेंट को अपनी सफलता की बहुत बड़ी प्राप्त मिल सकती है।
We wanted to serve the people who had no access to modern medicine. At the same time, we knew that they would not accept modern medicine as a total treatment facility. So we wanted to incorporate our Indian systems of Ayurvedic medicine, homeopathic, magnetotherapy, acupressure, acupuncture, the alternatives. In other words, we wanted to make it real holistic. One of the major emphases was also to incorporate meditation and the spiritual aspect. But we were only looking at the physical, mental and social part of a human requirement, but we were really missing out on the spiritual aspect, and this was the one which we really wanted to incorporate, and I think it's working wonderfully well. We started in a small way and went about in a phased way. In last 9 years, we have achieved the goals that we had set for ourselves in our project reports.
The GHRC has been conceived to include the natural healing forces that exist in nature and built with care for the environment.
We have tried and preserved each and every tree which was standing on site. We have built the hospital around the trees as we see here. Maybe we've also shifted the hospital once or twice to make sure we don't cut down trees. So that is one. Also the natural rock contours have been maintained and the hospital has been taken following the contours of the land. We were trying to blend the indoors and the outdoors. We have people coming from rural India who have not gone into large hospitals, into buildings, and they are uneasy to come into a building. They think it's for the rich people. So here when they come, they see trees, courtyards, they feel a little more at home. We have a double height, and as soon as you enter again you see courtyards. So the spaces are very integrated into one another. You will never find yourself within a restricted 4 walls. Every space we have tried so that the sun comes into the space to bring in a cheerfulness. So the patient sitting inside is also not in a claustrophobic environment, he is free. So there is an interaction between nature and the indoors.
Solar energy is utilized to provide power and hot water, as well as used exclusively to prepare the meals. The water is also recycled, thus protecting the meager resources and environment of the region. From the moment one enters the front door, the spirit of the place shines forth in the warmth of the staff. The staff of 90 includes doctors and nurses, as well as paramedical and technical staff, trained in major centers in India and abroad. They man 15 outpatient departments, apart from a family clinic offering love and care for physical and mental problems. The departments read like a big city hospital anywhere else in the world. Looking after the person as a whole, there is the Department of Holistic Medicine, Dentistry and Psychiatry. These major departments are backed up by in-house radiology, pathology and a blood bank, making up a comprehensive package of finest care. Leaving nothing out, there is an optical center and outpatient pharmacy under the same roof. Physiotherapy and magnetotherapy offer alternatives that are effective and inexpensive. Spiritual therapy and meditation find a special place, with patients, relatives and staff meditating together in special meditation rooms, creating feelings of universal harmony.
Even the very poorest and all the religious that come in here, whether we are Catholics, whether we are Christian, whether we are Hindus or Guru Nanak, Punjabi or whatever, and even the Harijans that come here from the poor localities, they get the best of treatment equally and free for those who are poor. The sister Lucia has been operated lately for her cataract, and it has been done by Dr. Sharma. And we have a very good experience of the kindness, the love, the affection shown to sister and to all of us, even in the Indo as well as in the OPD.
The inpatient wards have evolved in stages, now having a fully functional inpatient area comprising 20-bedded private ward, 30-bedded general ward, and a 20-bedded eye ward. The newly developed state-of-the-art operation theatre complex has provided opportunity for advanced surgical techniques to be practiced for the welfare of the needy. The basic principles of hygiene and cleanliness are reflected in the spotlessly clean wards and the OPDs. The safety of the staff and patients is ensured by following international standards of hospital waste management. The hospital services are backed up by a small but dedicated maintenance and administrative staff to ensure smooth and efficient functioning with the help of the latest technology.
We have been very lucky or fortunate that the team which we have, they have offered themselves for service. They have volunteered to come here. It's a small place, and they know that when the people whom they are serving, they may not provide them any monetary gain. So it's basically the concept of service and the natural feeling of fulfillment and goodness within has really inspired people to grow in their excellence. And the other thing has been because we have been interacting with various agencies from world over. They visit us, they come and discuss with us, they come and share their experiences with us, and we also feel very lucky that we have some things to gain from them, and when they appreciate our model of healthcare, we feel inspired to do more and more. It's a hospital which has been promoted for the whole universe. There are many international tourists who visit us, and when they visit us, they know that we know that we have to come up to their expectations, and so we try to provide them the care which they would definitely like or definitely would find different than what they have been receiving in other parts of the world.
The hospital participates in international and national programs while initiating many innovative projects. The Department of Cardiology is successfully carrying out coronary artery disease project, monitoring indicators of heart disease in volunteer patients through lifestyle changes of moderate aerobic exercise, vegetarianism, and Raja Yoga meditation for stress control. The World Bank sponsored Cataract Blindness Prevention Project is at work through the Village Outreach and Rural Healthcare Center, Talheti, Abu Road, apart from GHRC. The project has helped provide care to thousands at their doorstep and allowed them to literally see the light of the day.
ये क्या नाम मेरे पहले से कुछ फर्क है ना नजर आ रहा है मुझे, और उम्मीद है कि क्या नाम एक बार पढ़ूंगा और क्या नाम पढ़ के सही हो जाऊंगा मैं.
The hospital provides services not only to those who come to its door, but also reaches out to the tribals and poor in the villages around, providing them treatment as well as health awareness about topics ranging from malnutrition to hygiene as well as preventive medicine.
The village outreach programs have been very active, providing treatment through mobile vans with ambulance services helping the very sick and needy. The emphasis on health awareness has ensured early recognition and treatment of the prevalent illnesses, namely malnutrition, tuberculosis, diarrhea, eye and skin infections, orodental problems, etc. These programs have won the hearts of the local population by creating positive changes in their lives. This has also helped empower them, especially the women, for their own health. To ensure participation of the local population, young men and women from nearby villages are being trained as nursing assistants. Many of them go back to their own villages using their training to bring about permanent changes for their people.
मैं कैलाश नगर से आया हूँ, वहाँ पे लगभग 10,000 से ज़्यादा हैं लोग। मैं यहाँ नर्सिंग का कोर्स करके मतलब उनको ये बताओ कि शॉक्स का मतलब शॉक्स लगे या कोई इमरजेंसी कोई हो, जैसे स्नेक बाइट है, बर्न है, उनके बारे में उनको अच्छी तरह से नॉलेज दिलाना है। इमरजेंसी में क्या करना है अपने को, प्राथमिक उपचार के बारे में वो उनको बताना है। सीपीआर जैसे कि कहीं पर अर्जेंट काम हो जाए तो सीपीआर का यूज करना है।
The food for the body is provided through the hygienic hospital kitchen and consists of healthy vegetarian cuisine. The patients and the staff are provided the same food. Similarly, food for thought for the staff and visiting professionals is provided by the library. Continuing medical education programs in different specialities is achieved by many international and national conferences. Many dignitaries, social and medical luminaries from the world over have seen and appreciated the work of the hospital.
I think it's the whole setting. It's the spiritual background coming from Raj Yoga. It's the building itself, which is unique. It's the attitude of the people working here. Going to a point like traffic control you have at this hospital, where in certain intervals you have music turned on and people sit down and reflect what they do, which is really important. At our hospitals, people are running around all the time. They don't reflect. Maybe in the evening, maybe they are too tired then. This comes very near to my dream of a hospital. My dream of a hospital is doing high qualitative medicine in a nice surrounding, which should not resemble too much a hospital, but rather be a home, and in a good human atmosphere.
Here are some highlights of the hospital. Free consultations in OPDs. Services in hospital imparted free of cost. Free services to individuals of all religions or spiritual order. medical and surgical camps, village outreach programs, provision of free ambulance service and treatment van, conferences in varied specialities, exchange of students and professionals from within and outside India, projects in heart disease, blindness, malnutrition and substance abuse.
In keeping the situation of the hospital in mind, that it's located at such a place where it's surrounded by the tribal population, the poor population, which accounts for 80% of the patients coming to the hospital, and also keeping the future of these people in mind, and also with the concept of thinking globally but acting locally. So we plan to provide the best of not just health service but also to provide them with the proper education, and for that we are adopting the villages, the schools around us, so that we can become, we can set up good example for others to follow, how the people who are educated, the people who can afford and also who can receive the help from other connected philanthropic people, how we can pool together the resources to help such population who really need it.
मुझे याद है जब हमारा ग्लोबल कोऑपरेशन प्रोजेक्ट चला था, उस टाइम लंदन में ग्लोबल कोऑपरेशन हाउस निकला और नैरोबी में ग्लोबल म्यूजियम हुआ, यहाँ ग्लोबल हॉस्पिटल हुआ। अभी हमारे पास विश्व भर से यहाँ भी अब्बू में भी सब देशों से आते हैं, तो उनके भी अंदर में ये उमंग है, हम अपने अपने देश में जा कर के जैसे एजुकेशन के लिए वैसे हेल्थ के लिए वैल्यूज और मेडिटेशन से सेवा करें, सच्ची दिल से इंसानों की सेवा करें। तो उसमें भी निष्काम सेवा भाव से हम ये नहीं समझे हम सेवा में मान कमाएं या मनी कमाएं, मनी कमाने के नहीं, पर गांव-गांव में जहां जहां आवश्यकता हो हम हाजिर होकर के लोगों को हमदर्दी से मदद करें।
The task is big, but with vision, strength of unity, as well as the support and cooperation of like-minded people, it can be achieved to make the future disease-free and to help reach the unreached.
सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्।